Hello, Professor and class. My name is Jerry Schramm, and this is my presentation on business healthcare insurance proposal. The business I selected is Always Connected. It is a fictitious business I created. And a bio for Always Connected. It's a small family-owned computer business in Coatesville, Pennsylvania. It specializes in home and business computer repair, sales, installation of hardware networks, and performs network integration and network administration for small to medium-sized businesses. A company expansion. So over the last year, the company went through a period of growth. They added some additional clients and expanded the need for full-time employees. So they brought on additional employees that consisted of technicians, salesmen, administrators, support staff. Basically, this computer service goes into homes, fixes computers, goes to businesses, establishes networks, repairs networks. Basically, the soup to nuts from the home computer user all the way up through the small to medium-sized business. So as they doubled in size with technicians and support staff, they currently grew to a size of 65 full-time benefit-eligible employees. So my proposal was they contacted my organization, again fictitious, to evaluate some healthcare options for them. So their full-time staff increased from 47 to 65. This cost for greater than 50 employees, which also comes with additional requirements and potential penalties to consider with insurance. And they were interested in insurance options. Due to their recent increase in size, they had wanted to know what options they have moving forward. So it calls for an evaluation of where they were today with their insurance. So with a total of 65 full-time employees, 33 of their employees are single and 32 would need family coverage. Their salaries ranged from the entry-level $36,000 to established employees at $70,000. Employees currently secure insurance through the individual exchange. Being that they were under 50 employees, the employer chose not to offer insurance, and that caused for, as they matriculated into the current year and they grew, they now had an increase of employees. They did not offer insurance coverage, and they have an impending penalty of $70,000 due for not providing that insurance. And the company does offer a flexible spending account. The ACA exchanges, they're intended for small groups with less than 50 employees. Some of the options available are SHOP, the Small Business Health Options Program. Basically, it provides navigation and assistance in finding which health insurance plan is best for the individual through navigation of the exchanges. And there are tax subsidies available to workers, meeting specifics under the federal poverty level for employers for working for employers with less than 50 full-time employees. Employers with less than 50 full-time employees must pay a penalty if not providing coverage. That would be $2,000 for every employee over 30 employees. Hence the pending penalty that they have that I mentioned earlier. It must be considered affordable insurance with out-of-pocket costs not more than 9.5% of the household income. The coverage must meet 60% of the cost of benefits and must meet essential requirements. There is a posted list of these essential requirements would be met under the bronze package. We have the bronze, silver, gold, and platinum available under the ACA. So after analyzing their current position and what they're currently offering, my firm determined that these were two appropriate plan options for Always Connected. One would be the traditional preferred provider organization, a PPO plan, and that would have associated with a flexible spending account and an HRA, health reimbursement account. The other option we're proposing is a high deductible health plan, an HDHP, and that would be through preferred provider organization. It would have associated co-insurance and as well as in this health savings account. The preferred provider organization, there's 43% of small businesses today are offering PPO health plans. PPO allows more choice to employees with provider selection. The network's a little bit more diverse. They're allowed to pick and choose who they want to go to. Referrals are not necessary. It's a benefit for diverse staff. If you have staff members in different areas of different age groups, they very well may choose a provider that they've had for an extended period of time, or be open to new providers, but they like the flexibility and choice. The premiums may be a little higher than an HMO, and the out-of-pocket costs will also be higher. Flexible spending account, the employer owns this account. The employee contributes through pre-tax payroll deduction and a maximum set by the employer. So the employer lets the employee know there's a flexible spending account. The employee has the option of them placing pre-tax payroll deduction money into the account, and that can be used for healthcare expenses. But at the end of the year, any unused amount is lost, and it's typical that these funds may revert to the employer. An HRA, health reimbursement account, it's also funded by the employer. It's non-taxable income for the employer, can be set to offset the cost of medical expenses for the employee, and the employer defines which expenses are allowed. Basically an account that the employer is going to place money into pre-tax, and the employee will have access to use for health expenses, all set by the employer. High deductible health plans, HDHPs. In 2012, there was a survey that 19% of insured workers were enrolled in an HDHP. Studies found that the healthcare spending costs were reduced by 5 to 7% by those in HDHPs. More frequently in companies with less than 200 workers, less common in low-income groups, and cost less than low-deductible comprehensive health plans. It typically incorporates a health spending account, an HSA. A co-insurance percentage can be added after meeting the deductible. The co-insurance would be after you meet the deductible. All costs would not be covered at 100%, but there may be a percentage cost that the employee would still be responsible for. And the employees have more control since their healthcare spending. Basically, they determine what they're going to spend their healthcare dollars all on until the deductible is met. Basically, pick and choose whether you go to the ER or whether you go to the urgent care for that sprained ankle, because those dollars are coming out of your own pocket. Health spending account. The deposits are tax-free. Withdrawals are tax-free when used for healthcare expenses. Employees and employers both can contribute to the account, but it must be associated with a qualified HDHP. Qualified being it needs to meet certain deductible amounts to qualify. HSAs are portable. They can carry over from employer to employer year after year, can accumulate tax-free interest. The money spent rolls over from year to year, and controlled by the employee. Annual contributions can be limited to $32.50 for individuals and $64.50 for family, but this is also adjusted for inflation. So those were the recommended options. Options not recommended. We briefly touched earlier on the health insurance exchange and some of the negatives now that the Always Connected has exceeded 50 employees. So there's penalties and size restrictions, lost workers due to competition due to not offering insurance coverage and forcing them to go to the exchange. And there is a predicted increase of 34% for silver plan premiums in 2018, according to a recent U.S. News article. And there are other double-digit increases planned for the remaining plans available. Another negative option would be self-insurance. At this point, with the amount of 65 employees and just recently expanding their company with additional clients, self-insurance may be not the best option. You're responsible for underwriting all the costs. Depending on the health of the workforce, this could be costly. If you have a very healthy workforce with no medical expenses, these could be profitable. But if you have some older workers with chronic health concerns, this very well could tax the organization. It is advisable if the organization were to go with the self-insurance to get stopgap coverage. They can get aggregate or specific. Depending on the stopgap coverage, it could have its own high cost associated with, which could drive premiums well up to or above traditional plans. So both of these, the health insurance exchange and the self-insurance, they have benefits, but they're less than offered through the offered PPO and HDHP plans that my organization is suggesting. Reducing full-time workers below 50 would prompt reevaluation of the marketplace using SHOP. So if there was a change in the staffing levels at Always Connected to below 50, then re-exploration of the exchange may be an option. And if the workforce were to increase and there were success, so if Always Connected were to go with an HDHP and an HSA and find success, and healthcare costs remained balanced, and there was success with this particular program, then self-insurance may be an option further down the road. So again, the recommended plan is the HDHP with an HSA and co-insurance versus the PPO, but either options are suggested, but the better recommended plan at this point would be the HDHP with an HSA and co-insurance. Can use the qualified HDHP deductibles or go slightly higher. Build wellness incentives for the employees with employer contributions to HSAs. Basically require the employees to meet wellness initiatives, potentially stop smoking in order to gain some employer contributions to their HSAs, and the co-insurance after the deductible is met. In summary, the plan recommendation will allow Always Connected to adjust to the increased workforce and provide health insurance. Again, as they're transitioning, they're expanding to offer a health insurance plan. Very well may have a cost, and until they can realize that cost and understand it better, understand the direction of their organization, this may be a good option. It makes the employee accountable for the healthcare spending with a higher deductible in the HSA and provides a plan that can adapt over time. These were several references I used in composition of my presentation. I hope you enjoyed. Thank you.